An acute sickle cell pain crisis has nothing to do with labs or numbers. And I think this is a common misunderstanding that contributes to some of the skepticism doctors might have when it comes to thinking that patients are just faking it. You know, with every other condition that causes severe pain, people's labs or numbers are messed up, or you can just simply look at them and see for yourself that their leg is broken as an obvious cause. But with sickle cell, this is a microcirculatory event. So unless someone literally has like microscopic X-ray vision, they're not going to be able to see anything, because what's actually happening in the pain crisis is that the red blood cells are just changing shape and getting stuck in the small blood vessels, and they're being triggered to do that because of low oxygen levels from triggers like overexertion, dehydration, cold temperatures, infection, and blocking oxygen from reaching the muscles and bones and joints causes the immense pain that people with sickle cell present with. But the blood tests that most people look at, like hemoglobin, white blood cell count, platelets, they don't look at whether the blood vessels are blocked. They just show how many blood cells are in the bloodstream overall. So like I've said before, people with sickle cell can have a normal hemoglobin, even if it's like the lower level of normal. But in a crisis, they can still have thousands of tiny blood vessels that are clogged with sickle cells and experiencing a lot of pain. You know, it's a bit like traffic. You can have the same numbers of cars on the road, but if there's a jam in one area, then everything slows down and everyone involved is vexed, even though the car count hasn't suddenly dropped or changed. So your hemoglobin, infection counts, inflammatory markers, observations, they might change later on, depending on other complications that come up alongside the sickle cell pain crisis. But a snapshot of your bloods or numbers when you present to hospital isn't something that should be used to prove whether or not you're in crisis. So yeah, I think that is something that really needs to be understood, because it's just another hurdle to get through in terms of getting the treatment that you're supposed to get. At the end of the day, with sickle cell care, it's so important to just listen and believe the person rather than trying to rely on knowing better than them and evidence from labs and numbers. Yes, there are specific medical scenarios where the labs and numbers would obviously be important, but that acute presentation with sickle cell crisis pain, the numbers are not that relevant to just treating the pain. So please share this to raise awareness and prevent misunderstandings.